Hi, it's Dave. Welcome to my channel, Yard Sale. Hey, listen, I wanted to tell you a little bit about insulin resistance, diabetes, and metabolic syndrome. If you drink 10 ounces of water, or let's just say a 12-ounce can of beer, or 12 ounces of water, along with pasta, rice, sugars, sweets, any kind of carbs, and then you end up having to use the restroom if you have to pee 10 times in the next 4 hours, you're probably not just peeing out the liquids that you drank, you're peeing out all the carbs and sugars that you ate as well. This is a pretty good indicator that you could be either pre-diabetic, diabetic, or metabolically dysfunctional. All definitely worth looking into. I know it's a pain in the butt even dealing with it, but trust me when I tell you it's worth figuring this out before you get to metabolic syndrome. That's where the damage is much more long term. So again, if you eat things that make you feel like you have to pee, let's say you eat 3 apples and you didn't drink any water, but you have to pee 4 times, that's because your system is passing all the sugars, all the carbs through your body, and it's processing it to your bladder, and it's passing it all in pee. So frequent urination, even though you haven't had that much water or liquids, it's a pretty good indicator that you could be insulin resistant, insulin insensitive, have low insulin sensitivity, or be metabolically dysfunctional. It's definitely worth looking into. You should maybe talk to your doctor and get some tests run to check to see if you have insulin resistance, or what your insulin indicators are, to see if you have even some high blood sugars. If you have high blood sugars, guess what? You're lucky, because all you have to do is cut down on all those carbs and sugars, eat ketovore or carnivore for a month or 2 months, and then guess what, bro? You're in the clear. It's all good. You don't have to deal with the long-term stuff. But on the flip side of that, if you ignore all those indicators and you decide to just keep going with the flow, there are very bad things that could happen long term. And trust me when I tell you, it's not impossible, but it's very difficult. If you have any questions, do me a favor. Leave me some questions below and I'll answer them. Or any comments. Nice comments, that is. And if this is interesting to you at all, do me a favor and subscribe to my channel. I'll be adding a lot more content similar to this, which is my experience in dealing with prediabetes, diabetes, and metabolic syndrome, because I'm not a doctor. I'm not a healthcare provider. I'm actually not even really smart. I just watch a lot of YouTube and I needed to figure out what the heck was going on with me. So I hope you have a great day and I hope this is helpful. Have a good day. Bye-bye.